Workers with a local home health care agency call for wages that are closer to those of their hospital counterparts. Good evening and thank you for joining us. Local nurses, personal support workers, and caregivers with Bayshore Home Care Solutions held a rally today to raise awareness about what they call a growing crisis in Thunder Bay home care. The picketers accuse the company of not coming to the negotiating table, and they note they make significantly less than if they worked at the hospital. Jessica Clement reports.
Nurses and caregivers from Bayshore Home Care Solutions held a rally along Gulf Links Road, calling for a fair contract from the company. The OPSU members claim they haven't been able to negotiate anything with the company, despite being unionized since November.
From what we understand, they don't seem to want to come to the table and actually seriously look at what we're looking for. We're trying to make people's lives better, and we don't think it's fair that we should have to fight to do that.
Bayshore nurse and OPSU Local 745 President Kathleen Moore says there's been a lack of transparency.
We're not allowed to get any information of how much our government's tax dollars, are being allocated to Bayshore Company and to the people that make money off of us instead of that money going to healthcare.
Moore notes it's difficult to negotiate a fair deal when they don't know how much Bayshore is actually making. The company is a for-profit healthcare provider offering private and government-funded services. There are around 188 employees at Bayshore, with 30 of them being nurses and the rest being home care support. Moore alleges Bayshore's revenues are far higher than what they pay out to their employees, and adds their members earn much less than their counterparts who work at the hospital.
If the government pays a nurse at the hospital $40 an hour, well then they should be paying a nurse in the community $40 an hour.
Moore claims there are also thousands of home care visits that go unstaffed every year due to the wages and benefits not comparing to the hospitals.
We're in the community. We're the ones that go into homes. We're the ones that go into homes where there's weapons, where there's violence, where there's drugs, where there's all kind of stuff that nobody in any other part of healthcare has to deal with. And I'm not saying that we deserve extra money for doing that. That's part of our role. What I'm saying is we need to recognize that we're all the same.
No one from Bayshore Home Care Solutions was available for comment about the rally. Jessica Clement, TBT News.